Good morning. Thank you all for coming. And the reason why we are all here is to celebrate the person who won the Daisy Award for the month of March with 6 strong nominations. That is Jamie Moore. I'd like to tell you all a little bit about the nominations that she received. I'm going to read those for you because I think that it's very important to show you what everybody thinks about Jamie and what her patients and the people that work with her think about her. Nomination number 1 is Jamie is one of the most compassionate nurses I work with in the ECC. She is very much a patient advocate. Also, I have been impressed with her clinical assessment and judgment. But what makes Jamie stand out from her peers is her work to develop Code Maroon. Through a multidisciplinary project, Jamie's vision of a healthy work environment became a reality, with colleagues immediately knowing when a coworker has an excessive and need help, they pitch in. Code Maroon improves patient safety while improving staff satisfaction since they know that help is only a Code Maroon away. Thank you, Jamie. Nomination number 2. Jamie is the type of nurse that consistently goes above and beyond the call of duty. She treats all patients with kindness and compassion and always wears a smile. She is always calm in trying situations and is a true patient advocate. I first met her while I was an emergency room medical technician student, and her patience and encouragement with me through the time encouraged me to continue my goal and become a physician. I am extremely proud to call her my teammate here at Trinity Mother Francis. Nomination number 3. When Jamie works as charge nurse in the ECC, we, the nurses, never feel pushed beyond our capabilities. She dives in and helps for patients' care. She completes orders and helps increase patient throughput without creating undue anxiety. Nomination number 4. Jamie is always willing to go the extra mile to help everyone out at work on her own time. She is a great nurse and a great leader. Nomination number 5. Jamie has 10 years of dedicated caring in the ECC. Burnout is fast, so she shows her level of commitment to not just patients, but to the community. In the ECC, our patient population is our community, and Jamie cares for all every day when she walks in the door, doing everything she can to expedite their care so she can quickly be on their way back to health. Nomination number 6. I was working in the Trinity Mother Francis ECC one day, and I have to let you know our nurses rocked on an incredibly difficult day. The amount of teamwork that went on the day was tremendous. I was working as flow coordinator, caring for patients in the waiting room, beginning to implement protocols and guidelines, and doing whatever I could to get started promptly and move the patients into a room as quickly as possible. This can be a difficult job, why little thanks from nurses or doctors, but my job was made incredibly easy with the help of all of the staff that day. Everyone buckled down and did what they needed to do to be done with no complaint. I am not even sure I have the words to thank them, but I wanted to let you know I was inspired to see, and I was very proud of my Trinity Mother Francis family and honored to work with such wonderful nurses. Nurses like them inspire me every day. I just thought everyone should know because so many times it goes unnoticed. If it were possible, I would nominate them all for Daisy Awards for the excellent work and patient care that was demonstrated. A huge thanks to Jamie for her assistance that day. Now it is my pleasure on behalf of the Daisy Foundation to proclaim you, Jamie Moore, a Daisy Award Extraordinary Nurse. Here is your award certificate. And we'd like to read it for everybody. They can sit there and cannot see it. It says, in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people. And now we would also like to present you with the pin. We have some special individuals to pin you today. You look right over there. All right. And we also would like to present you with the statue of the Helping and Healing Hand. And we also have a banner. Well, actually the most important piece, the parking ticket. I'm about to say, I know this is the most important part, and this cinnamon for you to enjoy. And this banner will be, we flown in the ER for the next month to show everybody that we have a Daisy Award winner in our department. All right. Okay. So now I have a message from the Daisy Foundation. By definition, the Daisy Foundation thinks all nurses are extraordinary, and we wish we had resources to honor all of you individually. Nurses who receive the Daisy Award often say, everyone in the unit deserves this award as much as I do, or I don't deserve this, I was just doing my job. What the Daisy nurse may not realize, however, is that when the nurses are just doing their jobs, they have such an important and meaningful impact on the lives of so many people, many more than just patients. At every Daisy Award presentation, we ask each nurse to pause for just a minute and realize how very special they are and how much they make the world a better place by just doing their job. So today, a nurse's job entails many things, but no matter what they do, what the day brings, a nurse's impact is invaluable and long-lasting to their patients' lives and their families. So thanks to your education and training, your commitment and your judgment, your compassion, your connection to your patients, you are very special. You make the world such a better place by just doing your job. The skill and compassion you bring to the patient care makes a patient's outcome more positive and makes a family member feel just better by being here and being in healing hands. Please think about the impact you are having. Story after story bring this to light, and I would encourage you all to look at the National Daisy website and read the stories. The link is on the Nursing Public Access. And so I want us to all take a moment just to pause to realize how much we do impact our patients' lives and how much we impact the community as a whole. So kudos to everyone, and take a pause for congratulating yourself for doing your job. Prior to our closing prayer, I want to give a special thanks to you all, those who nominated Jamie. This award does not happen unless you take the time to write your nomination. It means a great deal to everyone. And thank you for choosing nursing as a career. To everyone in this room, your skills, your care, your compassion that you give to every day. And back to Jamie, congratulations. And before we get a chance to enjoy the cinnamon rolls that we have for you today and things like that, we're going to send it over to Tim for a closing prayer.